Hello. Are you not taking any supplements? Are you convinced you don't need any supplements? Or are you maybe taking supplements and you're convinced they are the right ones? Watch this video to get answers to these questions. I'm Olga, rapid transformational therapist and hypnotherapist. And there was time in my life about 20 years ago when I didn't believe in supplements and I was convinced that my food contains everything I need or everything my body needs, until I was diagnosed with autoimmune disease Hashimoto's thyroiditis. And then I started discovering supplements for myself, which led to remission of the autoimmune syndrome disease. So in this video, I want to show you how you can find reliable, scientifically proven information, which supplements are truly useful, which forms you need to take, in which amounts, and for which conditions. Stay tuned in.
Today I want to introduce to you a database, a free database, examine.com. So this database is led by scientists who review scientific articles daily, and they put the knowledge, the evaluation of this article all together in this database. This database is independent. It is not paid by any company producing supplements, and it is not dependent also on any universities. So, they earn money by memberships and selling some of their products, but you can find a lot of useful information for free on this database. Okay, so on this database they have some categories of the supplements. You can find separate supplements, information on separate supplements or special health topics, and as well they have their own articles summarizing research on some topics. And I want to show you, for example, we can look for magnesium. And in these articles, you will see that magnesium is often, people are often deficient in magnesium in developed countries, and this can lead to health issues. And then you can read a summary on magnesium and how to take it. It's also based on publications. And then at the end, you will see quite a long list called Human Effect Matrix. This is also special about this database, that it is reviewing only scientific publication on humans. And here you will see that, for example, the first effect is on blood pressure, and you will see that it is notable effect reducing blood pressure. And then you will see that consistency of these results in 9 different studies is moderate. Okay? Or serum magnesium is rising notably if you take magnesium supplement, which is logical, and this consistency of this result is high in 6 studies. And then you can scroll down and you will see that magnesium supplementation with magnesium has minor effect on asthma and glucose and hemoglobin, insulin, and notable effects on aerobic exercise and muscles oxygenation, minor reducing effect on C-reactive protein. It's inflammation in your body, marker for inflammation in your body. And then at the end you will see also that it has effect on sleep quality. It is improving sleep quality. It is reducing symptoms of depression, though minor, but very consistently, or tinnitus. And if you scroll down, you will see more information. You will see some summaries, and some of them which are marked with nerd, these are available only for the paying members, but there are some free articles as well, and there are some questions in answers are mentioned. Also magnesium, and more summaries about vitamin D and research breakdown. So that is how the articles are built, and I want you also to show an article about vitamin D. Here as well you see that already marked that it is an essential vitamin and that is very important for your health. You will see first the summary again and how to take vitamin D, then human effect matrix, and you will see a lot of effects of vitamin D. It is especially old people are deficient in vitamin D, so there are special articles for older people that the intake of vitamin D reduces the risks of fall, notably, and so we have also see that it is also reducing risk of cardiovascular diseases, parathyroid hormone, cancer, colorectal cancer, but there are more types of cancer which are affected by vitamin D. Asthma attacks are reduced, blood pressure reduced, body fat, bone fracture risks, also again is very important for old people, rate of sickness in general, upper respiratory tract, functionality in elderly or injured, very important effect. All-cause mortality, though minor effect, but all-cause mortality is affected by intake of vitamin D. Children are growing better. Influenza risk is reducing. Insulin secretion is improving. Insulin sensitivity as well improving. So you see, vitamin D influences so many aspects of our health, PMS, tuberculosis. Testosterone levels are slightly increasing. And more here down, the very strong effect on severity of COVID-19. Risk of multiple sclerosis is significantly, notably reduced. Asthma, breast cancer risk, cramps, and so on and so on. It gives you a picture, scientifically proven picture, how important is intake of vitamin D supplement. And below you will also find a study deep dives. So most of them they are for free. One has to be a member of examen.com. There are some quite few questions about vitamin D covered by examen.com and things to notice. Now I want to show you an article on anxiety, for example. And a similar overview. So there is an introduction on anxiety. The article also speaks about the causes, symptoms, and diagnosis of anxiety, and then there's also treatment. Okay, there is a wonderful article overview on symptoms of anxiety, how diagnosis is made, different types of anxiety disorders, treatments, and there are already supplements mentioned which are known to help anxiety, therapies, meditation, different practices that help anxiety. And then there is also a human effect matrix. And in the human effect matrix, you will see only 3 supplements that are helping anxiety, and if you want to see more, you need to pay for that. Below you will have again study tip dives, where there is more information that you can find, and some frequently asked questions. So, and now I wanted to show you some of the recent articles of Exam.com, the effect of the lemon water. If it is good for you, it is quite a popular practice to drink lemon water in the morning or throughout the day, and the author is talking about different claims and is showing if there is any scientific evidence for these claims. And it's quite a long article, and so I wanted to show you this. For example, one claim if lemon water aids digestion, and here the author is mentioning that it can help only if you have low citric acid, or if you have low stomach acid, and if you have, then you rather go to the doctor, right? But it doesn't mean immediately that if you have low stomach acid that you are immediately already sick. Okay, so it's very simple. As we age, we change externally, but also internally. So all the functions in our body become weaker. So actually, anyone above 30, especially above 40, they will have weaker digestion, and then it is a whole population within this age actually can benefit from drinking lemon water. So just want to show you that there is so much valuable information in this article, and just about some things one needs to be a little bit careful. And I started using Exam.com some time ago, and I'm continuously using it, and encourage you also to check for useful information, to check if you are taking the right supplement, if you are taking the right doses. You can find this information on Exam.com, and of course you need to speak with your doctor if you have some more serious issues. Thank you very much for your attention, and talk to you soon. Bye.